Hej och välkomna tillbaka till Erik Bank och vår temadag Medicinsk, Bildteknik och Diagnostik. Det har blivit dags för dagens första bolag som ska presentera idag och det är Spago Nanomedical. För att presentera bolaget har vi bolagets vd Mats Hansen. Mats, välkommen och du kan starta din presentation som kommer att hållas på engelska.
Thank you. Imagine you need to explore an area that you're not actually able to go to. What you can have are coordinates. You might have some information on the location, on the height, the temperature, but you don't get an actual feel. Next slide, please. An image says more than 1,000 words. And when you can have the details in front of you, you can see the edges, you can see the lumps. In medicine, proper imaging may be the difference between life and death. Next slide, please. A warm welcome to this presentation of Spago Nanomedical. I'm Mats Hansen, I'm the CEO of the company, and I work together with our team of highly skilled scientists here in Lund, in southern Sweden. Today, I would like to provide an insight into our company and especially into our project Spago Pix, which is in medical imaging and its potential to significantly improve treatment and diagnostics of lethal disease. So the agenda for this presentation is why do we need medical imaging? And that's what I started with to try to explain that. I will mention a bit about Spago Nanomedical in brief, and then go into the current imaging methods and the needs that are in the area for new techniques. I will then go into Spago Pix, our diagnostic imaging project, go through the clinical evidence that we have, the positioning of the product and the market. And then at the end, I will try to sum it all up for you. Next slide, please. So Spago Nanomedical is a clinical stage company with a unique platform technology that addresses significant challenges in the clinical management of major cancer indications. We have built a considerable and a unique expertise in nanomedicine, and we are in possession of a material that can be tailored into functional nanoparticles for physiological targeting to tumors and provide for precision diagnostics and treatment of cancer. Our pipeline projects, Spago Pix and Tumorad, have the potential to solve important clinical problems in diagnostics and in treatment of major cancer indications. Spago Pix, which is the reason we are here today, is a nanomedical contrast agent for magnetic resonance imaging, MRI. The goal with the project is to provide more precise visualization of tumors than what is possible today. Our other project, Tumorad, is a therapeutic that enables internal radiation to tumors with precision and opens for effective radionuclide treatment of metastatic disease and better patient outcome. Our business model is based on out-licensing of nanomedical projects that are in clinical phase. Next slide, please. So, cancer imaging is increasingly important. And why is that? Well, as Claus said in the introduction to this day, we have an aging population, which means that the numbers of cases of cancer and other potentially lethal diseases are in fact increasing. The good side of this is that the therapeutic alternatives are also increasing. And also the diagnostic methods are increasing. And by that, I mean different kinds of blood tests, for instance, and other markers of disease. What it all ends up in is a need to visualize this in the body. And there are a number of techniques available already today. You have them listed here. We have ultrasound, which is cheap and simple and can be used very swiftly. We have mammography that is used routinely as a screening technique. We have computed tomography, or CT, that is a very good technique to visualize soft tissues. We have MRI, magnetic resonance imaging. We have SPECT and we have PET that are radioactive techniques. All of those have their pros and cons. And next slide, please. But what they have is the problems that we see today are in regards to sensitivity. You can always face the risk that tumors goes undetected with any of these techniques. You may have insufficient specificity, which means that you see a lot of things, but they don't actually represent lethal disease or disease that is treatable or even should be treated. They might come with the risk inherently, like ionizing radiation, for instance, or you might have used contrast agents that in themselves bear some kind of risk for the patient. And you also have the costs, and all of these have different costs, and obviously the more specific you need to be, the more costly the procedure in general. Now, MRI, as highlighted here, is a very good technique. It provides a very high resolution of soft tissue. It is based on radio waves, so it's not radiation. You don't expose the patient to any kind of ionizing radiation. It can be used with contrast agent or without, depending on the indication. The cost is reasonable, at least compared to the more modern modalities like PET. Next slide, please. So let us go into SpagoPix, our imaging agent, our contrast agent for tumor selective MRI. This product and the product candidate is called SN132D. That term, I will use that term throughout this presentation. SpagoPix has the potential to significantly improve cancer diagnostics through more precise visualization of tumors and metastases. Next slide, please. So if we look into breast cancer, for instance, where MRI is already today an established modality, it's used routinely to visualize the tumors, both when it comes to screening of high-risk groups, especially in the United States, but also to confirm previous findings, for instance, on mammography. It's a very good technique. The problem is that the contrast agents that are used today are unspecific, which means that they are not uniquely designed to go into the tumors. They spread rather evenly throughout the bodies, and some of it ends up in tumors, which makes it possible to visualize them. But this unspecificity leads to a number of shortcomings. In the screening settings, you have the problem of inaccurate diagnosis. It could be false negatives, which could potentially be detrimental to the patient because it means you can miss cancers, or you might not get going with the treatment soon enough. The flip side is the false positives, which means that you think you're seeing something that is malignant, but it's actually not. And that will cause the need for extra biopsies, for instance, or other follow-up procedures, which will be costly for the healthcare system and, of course, a burden for the patient. Then you have the pre-operative MRI setting. That means when you are confirming previous findings before surgery, what you want to do then is to delineate the tumor in a good way so that the surgeon can perform his best or her best to remove the cancer. Now, the problem with today's contrast agent is that they don't provide very much information on the aggressivity of the tumor. So the grading of the tumor is rather imprecise, which means that the surgeon might need to remove a lot more tissue than should otherwise be the case. So there is today a rather high rate of mastectomies, meaning that you remove the whole breast rather than just the tumor. And also when it comes to breast conserving surgery, which is becoming more and more common, there is a high rate of reoperations because the surgeon misses some parts of the tumor, remaining viable tumor cells that might spread later on. So in summary, there is a need for increased diagnostic precision to reduce costs and to improve treatment outcome for MRI in breast cancer. Next slide, please. So with SpagoPix and the product candidate SN132D, we can actually provide this. The results we've got so far from the clinic shows that the precision that we are after is exactly what we can offer. We see in the left hand side of the image a schematic view of what we are after, namely the precise localization and determination of the tumor compared to the surrounding tissue. And on the right-hand side, you have the real-world evidence showing a tumor in a breast, very well delineated. You can also see some structures within the tumor showing potentially dead areas and telling you something about the aggressivity of the tumor. So we have proven that our nanomaterial accumulate in human tumors, and this opens up for precision diagnostics and also for therapeutic applications, which we are pursuing in our TumorAD project. Next slide, please. So we have an ongoing clinical trial with SpagoPix. It's called SpagoPix 01. It's ongoing in Sweden at 2 hospitals in Uppsala and Gothenburg. And as always in a phase 1 setting, safety is of course the primary endpoint, but we are able to collect efficacy data in the form of MR images as well, which is of course an advantage for this early stage. The study is designed to recruit up to 20 patients with confirmed breast cancer, so we know that they have breast tumors. And as I said before, we now have interim results that indicate clinically relevant MRI of breast cancer. And this provides the first proof of concept for SN132D, enhancing MRI of solid tumors. And we have positive and as well, and I should say this is in breast. And apart from that, we also have a positive and potentially clinically relevant contrast in the pancreas, which is a very interesting area as well for clinical imaging, and where there is a large clinical need for new improvements to fight the, for instance, lethal pancreatic cancer. We'll come back to this a little bit more later. The final data of this study is expected this year. Next slide, please. So let's have a look into what we have seen so far. These are images from a 71-year-old woman with newly diagnosed breast cancer. She was given 20 micromole per kilo of SN132D by infusion, and MRI was run at 3 Tesla. Now what you can see to the far left is the image before contrast agent was delivered, so pre-infusion. And on the right hand, you have post-infusion at 2 hours and 4 hours. So this is what we explore in the study, different time points for contrast enhancement. And you can clearly see by the red arrow where the tumor location is. You can see that the margins of the tumor are clearly delineated with the contrast agent. You can see that there is this dark area in the tumor, which is probably a sign of necrosis. You also see some other structures in there if you look carefully. So what this shows is that SN132D is able to clearly identify tumor margins without background enhancement. And this is exactly what we're after in order to increase precision. Next slide, please. Now, this is another example. Again, it's breast cancer. The images were taken from a different angle. So what you see is by the red arrow is the breast, and in there is a lump of some kind. And you can see to the far left that it's very difficult to tell what's happening there. It's a kind of a mess of tissue. But when you look at the two images to the right, especially the one in the middle, the post-infusion 2 hours, you see that the tumor lights up very well. So this is actually an aggressive tumor that is present here. As a side note, you can also see a very bright spot to the left side of the two images to the right. That is the liver that lights up. And we do look at both liver and pancreas as well in this trial. So what this tells us is that we are able to provide high precision imaging over hours compared to the contrast agents today, where you only have minutes to perform the imaging. Next slide, please. So what we've also seen, and as I was saying earlier, we do look as well into the abdomen of the patients. We look at the contrast that is provided in the liver and as well in the pancreas. And what we have seen so far is a very positive contrast enhancement in the pancreas at different clinical doses, which is very good. So what this means is a potential for high resolution imaging, for instance, to look at ductal infiltration of various kinds of cysts or precancerous lesions in the pancreas. And as we all know, pancreas cancer is a lethal disease. It's very aggressive. And there is a strong clinical need for identification and follow-up of these precancerous and potentially lethal cysts or lesions. And there is no MRI contrast agent specifically indicated for pancreas available on the market today. Next slide, please. So what about safety, which is the primary aim? Well, so far, intravenous infusion of SN132D is considered safe and well tolerated at different doses. We have seen no clinically significant findings. We have some transient elevations of liver enzymes, which goes away very quickly and are asymptomatic. And we have indications that the dose of 20 micromole per kilo is the best one for breast cancer imaging, and the dose for 10 micromole per kilo might be sufficient for pancreatic imaging. Next slide, please. Now, I will move over a bit to the positioning of Spago PIX and SN132D in comparison to the existing contrast agents and to the pipeline agents that are in development right now. The ongoing trend that we have seen for a while now, and if you look into the clinical development of new contrast agents, you can see easily that the trend is going towards non-gadolinium-based agents and to agents that are specifically tailored to image certain tissues or certain areas of the body. This is where SN132D is positioned. We've already said that it's tailored to look into breast cancer and into solid tumors more generally. We have a few other agents in development right now that are developed for different indications. You will hear about at least one of them today as well. And next slide, please. And if we look into the companies that are on this kind of scale, you can see that the companies in the far right corner are all developing new agents, whereas the existing ones in the bottom of the figure are the established players on the market today, which are all fighting with expiring patent portfolios, meaning that they are in need to fill their pipeline with new agents. And there are a few in development right now, for instance, Gadopiclenol by Burger Bay, and there is another one from Bayer being developed right now. But again, those are all based on gadolinium. And gadolinium is an agent where there has been safety concerns among regulators. That's why there are a number within brackets there, because those have all been withdrawn or restricted on the market because of these safety concerns. So there is clearly a need for something that is not gadolinium based. And in our case, we are using manganese as the contrast enhancing agent in our particles. Next slide, please. So what are we trying to achieve? Well, we see Spago PICS as a project where we are combining the benefits of MRI and of PET, because PET is a very good technique to actually visualize tumors explicitly, because it's tumor selective. Now, the MRI of today using gadolinium contrast agents, shown to the far left in this slide, provides high resolution images. It has broad applicability. It can be used for many different tissues, and it's not radioactive, which is, of course, an enormous advantage. On the other hand, it is not tumor selective. And when it comes to breast cancer, it is also negatively impacted by breast anatomy. For instance, dense breasts are difficult to image, and it's also sensitive to estrous cycle in the woman. You have time constraints because the agents are leaving the body within minutes. So you have a very short time interval to actually capture the images you want. And there are the safety concerns, which I mentioned earlier. With PET, and now I'm talking on FDG PET, which is a standard technique. It is tumor selective, which is very good. You know often that what you see is the tumors. On the other hand, it has very poor resolution. It is radioactive, and it's rather expensive. So in the middle, we have SN132D MRI. We provide tumor selectivity. By MRI, we provide high resolution. It is not radioactive. It has applicability in different solid tumors, soft tissue solid tumors, like breast cancer is the obvious example right now, but we see a potential also in other types of solid tumors like pancreas cancer, colorectal cancer, and others. We have no safety concerns so far. The imaging time is very favorable. The operator is allowed to collect images over hours rather than the minutes they have today. And it is affordable compared with PET. So what all of this leads to is a better chance to have the correct diagnosis, to reduce the confirmatory procedures, which is very important because additional biopsies, for instance, increases the risk of metastatic spread of the cancer. And of course, increased treatment precision, like I was saying before. And all of this ends up hopefully into improved patient outcomes. Next slide, please. So Spago and SN132D in MRI could save lives and reduce healthcare costs. Looking into the figures in the different cancer indications, we know that breast cancer is one of the more common cancer forms. It's a couple of million cases every year. It's lethal in too many cases, unfortunately, although the therapy has progressed very good over the last 10 years or so. But it is number 4 in mortality ranking today. If we turn to pancreatic cancer, the incidence is lower, but it is expected. It's a very lethal disease. It is expected to become number 2 in cancer mortality in the coming 10 years. There is no tumor selective MRI contrast agent available on the market today. And what we expect is that a specialized product, and we see this also in other cases, that specialized products are applicable for premium pricing, and that drives also the market size. And our estimations currently is that the breast cancer market alone is worth around 500 million euros every year. And of course, then we have the potential to expand the use of Spago into other solid tumors and potentially beyond that as well. So the market is substantial and already today, and there is a potential for expansion. Next slide, please. So where can we use SN132D? Which are the settings that we see? And now we're coming from the breast cancer side, but this actually applies also to other cancer forms. Well, it can be used in the screening setting to improve accuracy, to reduce the number of false positives and potentially false negatives that are seen. It can be used for staging of the cancer, which means that the better delineation of the cancer tumor, the less chance or risk for reoperations. So it can reduce the reoperation rate and the surgical impact on the patient. For diagnosis, well, again, if with better precision, you can probably reduce the number of biopsies. And biopsies is a good way of actually getting knowledge about the cancer cells, but it also poses a risk for metastatic spread of the cancer, for instance. And you can use it for follow-up and to follow treatments to see if they work, but also to follow the patient and look for recurrence of the cancer to capture early recurrence. Next slide, please. So what we believe is that Spago can bring improved imaging and reduced cost for the healthcare system. Next slide, please. Now, this is a busy slide, but it is to explain the mechanism and the design of our particles. I will do that briefly. We are using physiological targeting as a means to reach the tumors. This is done through the enhanced permeability and retention effect, which has been clinically confirmed in many cancer forms. And it means basically that the cancer tumors are surrounded by leaky blood vessels that allows macromolecules like nanoparticles to diffuse into the cancer tissue. And this is increasingly pronounced in aggressive tumors. So there is actually a way for us to tell which tumors are more aggressive based on the accumulation of our particles. It also allows for efficacy that is independent of molecular interactions. And by that, I mean that there are no requirement to bind the molecules to the cancer cells in order to do what we want the molecules to do, or the particles to do. And we are working with functional nanoparticles. And by that we mean the particles themselves are enough to provide the efficacy we want it to do. And now I see my time is getting out, but eventually what we want to provide is high precision and high resolution. So one final slide to sum up. Next slide, please. Or actually two slides, but let's start with this. So what we have in front of us now is the readout of the clinical study. We are progressing our second projects to clinical phase, and we are looking to out-license the Spago Pix project or to find a development partner to take it to the market. And eventually we will also grow our pipeline of projects. Next slide, please. We have the technology, we have the evidence. We believe we have a pipeline of very good first-in-class products that meets major needs. We have a good team, and our business model is proven, and the market we see is substantial with multiple indications. So thank you very much for listening, and I'm happy to take questions.
Okay, thank you very much, Mats. Let's shift to Swedish in the Q&A session. Mats, ni är på väg att försöka hitta en partner till SN132D som har väldigt bred potential. Kan du berätta lite vad som skulle vara en bästa optimala tagaren för det här projektet utifrån just den potentialen det har?
Ja, men vi tror ju att någon av de här 4 etablerade spelarna är bra tagare för projektet. De har resurser att driva utvecklingen. De har också marknadsresurserna för att lansera ett nytt projekt på marknaden. Och de har också, som vi ser det i alla fall, behovet av att fylla sin pipeline, eftersom vi ser nu att de flesta av de här gamla kontrastmedlarna tappar patent och därmed blir utsatta för generika konkurrens. Och vi ser även den typen av konkurrens sinsemellan i de här bolagen. Just
det. Ni har ju nanopartiklar. Det är inte en jätteväl etablerad koncept för kontrastmedel och inte för läkemedel heller, även om det finns en del sådana. Men kan du berätta lite hur pass långt ni har kommit i själva tillverkningen av de här partiklarna och vad som behöver göras för att det här ska kunna hålla en klass för att kunna ta det här in i sena kliniska utvecklingsfaser och kanske till och med till en kommersialisering?
Ja, vi har ju etablerat GMP-tillverkning i hyfsat stor skala av de här partiklarna. Och vi ser också att den processen går att skala ytterligare uppåt. Så att där ser vi egentligen inget problem. Och vi har också demonstrerat väldigt bra hållbarhet till exempel för de här partiklarna. Så att vi har just nu tror jag ett par 3 års hållbarhet i kyl och frys för de här partiklarna. Så att logistiskt och produktionsmässigt så ser vi inte att det här skulle utgöra några problem för så att säga en kommersialisering eller fortsatt utveckling.
Okej, jättebra. Jag tänker också fråga lite om den fortsatta kliniska utvecklingen. När ni väl kommer i mål nu med fas 1-studien, vad är det för studier som kommer behöva göras för att ta det här till marknaden?
Ja, inom bröstcancer så behöver vi ju naturligtvis, eller vi eller en partner, gå vidare till fas 2 och fas 3. Det upplägget vi har just nu visar inte på att vi behöver göra någon jätteomfattande studie i ett första fas 2-upplägg. Och den kan eventuellt också gå över och bli en fas 2-3. Det där blir ju en diskussion man får ta med myndigheterna. Likadant på pancreascancer till exempel, eller på pancreas, där behöver vi demonstrera att vi kan så att säga fånga upp de här cysterna eller lesionerna som kan leda till cancer på sikt och göra det på ett bra sätt. Och även där har vi ett upplägg på en studie som skulle kunna sättas igång ganska omgående.
Mm. Spännande. Jag tänkte också, vi har ju fortfarande en ganska hög smittspridning av covid-19 och sådär. Hur är status för att rekrytera patienter egentligen till fas 1-studien?
Ja, nej, men det är fortsatt en utmaning, och det har varit en utmaning under hela året som säkert alla vet, och så har det varit för många, och kanske de allra flesta som bedriver kliniska studier, särskilt i tidiga faser. Vi har sett en liten lättnad nu. Vi ser att det åtminstone kommer in patienter till klinikerna igen. Och sen ser vi också att resurser börjar återvända till de team som så att säga ska rekrytera patienterna och utföra studien. Så att det kommer ju att lätta naturligtvis. Och vi ser tecken på det och har sett det nu ett tag. Så att vi hoppas att kunna slutföra det här inom kort.
Och inom kort, när tror du kan ge ett klarare besked kring just den här studien, när den kan slutföras, tror du?
Vi kommer att ge besked när vi har sammanfattat den pågående dosgruppen. Både när det gäller så att säga fortsättningen på studien och de resultat som vi får vid det tillfället.
Just det. Som du beskrev under presentationen så är det ju relativt få ändå konkurrerande produkter under utveckling, och det dominerande är ju gadolinium idag på marknaden. Ser du andra potentiella konkurrerande, exempelvis på tekniksidan på MR-kameran, som skulle kunna störa utvecklingen utav Spago Pix?
Ja, det sker ju utveckling på olika håll. Mycket av det, som jag bedömer det, är fortfarande i utvecklingsskede, och det är svårt att bedöma vad som faktiskt når ut och blir så att säga brett använt på klinikerna så småningom. Jag ser inget idag som utgör direkt hot till ett nytt kontrastmedel. För det vi faktiskt gör med Spago Pix, det är ju att förbättra själva bilderna i sig. Sen kan det finnas olika tekniker för att fånga bilderna eller för att analysera bilderna. Men vi tillför ju någonting som förbättrar bilderna i grunden. Och det tror jag inte är någon nackdel oavsett vad som händer runt omkring.
Just det. Det är också en fråga kring Tumorad. Den är ju preklinisk. Har den kunnat löpa på trots covid-19?
Ja, det har den. Det har gått väldigt bra med Tumorad. Nu ska vi kanske inte gå in i detaljer på det, men det ser väldigt bra ut så här långt. Vi genomför nu de prekliniska tester som krävs för att skicka in ansökan om klinisk prövning, och vi håller på med GMP-produktion av material, och så här långt så rullar det på väldigt bra.
Just det. Jag tänker på, ni använder ju utav EPR-effekten. Vad kan man säga om den egentligen? För att den kan ju, så som jag förstår det, är det ju att om man tittar på patienten så kan det ju vara en ganska stor skillnad mellan den enskilda patienten, huruvida den här lössläppigheten i blodkärlen och så. Vad vet ni om det idag, och vilka typer av patientgrupper som skulle kunna vara intressanta för Tumorad?
För Tumorad, det är ju ett faktum att EPR-effekten är heterogen. och därför är det ju bra, för Tumorads del är det ju bra då att vi vet att vi har ett kontrastmedel till exempel som kan fånga upp tumörer som faktiskt uppvisar EPR-effekten. Och med Tumorad i sig själv så kan vi ju använda det, eftersom det är ett radioaktivt läkemedel, även som imaging så att säga, och på det sättet välja ut patienter där vi ser att Tumorad ansamlas i tumörerna. Så att därigenom minskar man ju risken i det projektet ganska dramatiskt, för att man behöver inte då gå in i behandling i patienter som man vet på förhand inte är lämpliga kandidater. Just
det. Jag såg också på en av dina första bilder här att det har dykt upp ett new project. Kommer ni, hur är status för den typen, och hur tänker ni långsiktigt som bolag? Är det här någonting ni ska göra, att tillföra nya projekt?
Alltså, vår nuvarande affärsstrategi går ju ut på att utveckla projekt till klinik och sedan hitta partners för den fortsatta utvecklingen. Och i det blir det ju naturligt så att efterhand som våra projekt går in i klinik och så att säga samlar på sig proof of concept, så vill vi också kunna bygga pipelinen underifrån, och där finns det en hel del idéer som jag inte går in på just nu, men så ser det ut och så är tanken.
Men ska man tolka det som att ni har fokus på nanopartiklar och EPR-effekten? Det kommer vara det som genomsyrar hela er pipeline, eller ska det kunna finnas andra koncept som ni testar?
Nej, men det är ju naturligt att vi utnyttjar den kompetens och den teknologi vi har. Och vi har ju blivit under åren experter på nanomedicin och på nanopartikeltillverkning och olika applikationer av det. Så att det är ju naturligt så att det är det spåret som vi i första hand utforskar även framåt.
Mm. Ni gjorde en nyemission här lite tidigare i år. Om du kan berätta lite vad det ger för finansiering av bolaget för att ta era projekt framåt.
Ja, syftet med det var ju en ganska offensiv kapitalanskaffning, och syftet var ju just att säkra vägen för Tumorad fram till klinik, så att säga, så att vi har det kapital som krävs för att så att säga komma till en punkt där vi kan starta den kliniska prövningen med Tumorad. Så att just nu är vi välkapitaliserade, och det ger ju också en styrka såklart i förhållande till partner och till partnerdiskussioner för Spago Pix, att vi så att säga inte sitter på bar backe när vi...
Just det. Och slutligen då för att tack, för nu var tiden ute här. Tack så jättemycket, Mats, med ursäkt för jag hade lite problem med ljudet här. Vi går vidare.
Tack så mycket, och tack till er som har lyssnat.
Tack.